Most retirement plans assume you're one half of a couple. Yours might not be. And if it isn't, the standard advice you've been hearing for years may not fit your life at all. Here's the reality most retirement content ignores. If you're single, divorced, widowed, or simply without close family nearby, the entire framework built into mainstream retirement planning quietly assumes something that doesn't apply to you. It assumes a second income, a second decision maker, someone to catch you if something goes wrong. Financial planners have started calling this population solo agers, and if that describes you, you already know how often the advice out there just doesn't translate. Let's name the specific gaps one at a time, because vague reassurance doesn't help. Specifics do. Gap 1. Income planning. Most retirement calculators and most of the advice built around them assume 2 Social Security checks, sometimes a pension for each spouse, and the ability to survive a temporary income gap because a second person's earnings can cover the difference. If you're solo, there's no second check. Every income decision, when to file for Social Security, whether to convert retirement accounts, how much to withdraw each year, rests on one set of numbers with no backup plan built in from a partner's income. This changes the math in a specific way. Delaying Social Security to maximize your benefit, a strategy that makes enormous sense for a lot of people, requires a bridge of savings or other income to cover the years before that larger check begins. In a 2-income household, one spouse's income can sometimes serve as that bridge for the other. Solo, that bridge has to come entirely from your own savings, or a part-time income you build yourself. This isn't a reason to abandon the strategy, it's a reason to calculate your specific bridge with more precision, because there's no fallback if the math is wrong. Gap 2. Healthcare decisions. This is one of the areas where the solo gap becomes most personal and most urgent. Every hospital discharge form asks the same question: who is picking you up? Every surgery requires someone to sign as your emergency contact, someone to be reachable for the first 24 hours after anesthesia, someone to help you get home safely. Most healthcare systems are built around the assumption that a spouse or adult child handles this role automatically. If you're solo, this isn't automatic. It has to be built deliberately before you need it. This means having a designated healthcare proxy. Someone with legal authority to make medical decisions if you can't, even if that person isn't a spouse. It means having at least 1 or 2 people, a close friend, a sibling, a trusted neighbor, who know they're your emergency contact and have agreed to that role in advance, not discovered it when a hospital calls them cold. It means keeping a written, accessible list of your medications, your doctors, and your advance directives somewhere a stranger could find and use in an emergency, because there's no spouse in the next room who already knows all of this by heart. Gap 3. Long-term care. This is the gap that keeps solo agers awake at night more than almost anything else, and it deserves to be named honestly instead of glossed over. Couples often plan for long-term care, assuming one spouse can care for the other at home for a period of time before more formal care becomes necessary. Solo, that informal caregiving stage often doesn't exist. The transition from independent living to needing support can happen faster and with less warning because there's no one in the home noticing the small declines early. This is exactly why long-term care insurance, or a specifically earmarked long-term care fund, matters more for solo agers than for almost any other group. It's not just a nice-to-have, it's often the single most important piece of the entire plan, because it's replacing a role that a spouse would otherwise fill informally and invisibly. Gap 4. Legal and estate structure. Married couples often default into certain legal protections automatically: spousal inheritance rights, automatic decision-making authority in a medical crisis, survivor benefits built into retirement accounts. Solo agers don't get these defaults. Every single one of these protections has to be built deliberately through a will, a power of attorney, a healthcare directive, and clearly named beneficiaries on every account. Without this, decisions about your care and eventually your estate can end up in the hands of a court or a distant relative you haven't spoken to in years, simply because nothing was documented in advance. Now let's talk about the desire underneath all of this. Because solo agers aren't looking for pity, they're looking for the same thing every retiree wants: autonomy, certainty, the ability to age on their terms without becoming a burden to anyone, and without a crisis forcing decisions to be made by someone else under pressure without your input. That desire is completely achievable solo. It just requires replacing the informal safety net a spouse or family provides with a deliberate built one. Let's walk through what that built safety net actually looks like, piece by piece. First, your care team. This isn't a spouse, but it can be one or two trusted people, a close friend, a sibling, even a paid geriatric care manager if you don't have close family nearby. This person or people should know they're your designated contact, have a copy of your healthcare directive, and know where to find your important documents if something happens suddenly. Second, your financial bridge. As we discussed, this is the calculation that lets you delay Social Security, if that's the right strategy for you, using your own savings or income rather than a spouse's earnings. This needs to be calculated with more precision than a typical retirement plan because there's no second income to absorb an error. Third, your housing plan, thought through before it becomes urgent. Where will you live if stairs become difficult? Is your current home realistically age-friendly, or will it require modification? Are you near enough to services, or would a move closer to a care-friendly community make sense while you're still able to make that decision on your own terms, rather than in a crisis? Deciding this in advance, while you have full capacity and no urgency, is fundamentally different from deciding it during a medical emergency. Fourth, your legal documents, updated and accessible. A will, a durable power of attorney for finances, a healthcare proxy or advance directive. And critically, these documents need to be somewhere your designated contacts can actually find them, not locked in a safe deposit box no one else has access to. Fifth, your long-term care funding plan, whether that's insurance, a dedicated savings account, or a hybrid life insurance policy with a long-term care rider. This piece deserves more attention and more funding priority for a solo ager than for someone with a spouse who might otherwise provide informal, early-stage care. Let's talk through a real example, because this becomes clearer with a specific story instead of an abstract list. A woman in her late 60s, divorced for over a decade with her only child living several states away, had built a comfortable retirement on paper. She had savings, a paid-off home, and a modest pension. But when she sat down and mapped out her plan against these 5 pieces, she realized she had never designated a healthcare proxy. She had never told anyone specifically that they were her emergency contact. Her will was over 15 years old and named an ex-brother-in-law she hadn't spoken to since her divorce. Working through this process, she designated a close friend as her healthcare proxy and had an honest conversation with that friend about what the role would actually involve. She updated her will, updated her beneficiaries, and had a frank conversation with her daughter about what she wanted if a health crisis happened while her daughter was still hours away by plane. None of this cost significant money. It cost time and the willingness to have some uncomfortable conversations in advance, rather than leaving those conversations to happen under pressure during a crisis without her input. That's the transformation available here. Not eliminating the challenges of aging solo, because some of those challenges are real and shouldn't be minimized, but replacing the invisible safety net a spouse would have provided with a visible, deliberate one you build yourself, on your own terms, while you still have the full capacity to build it well. Let's slow down on one piece specifically, because it's the one people most often assume they've already handled when, in reality, they haven't. The healthcare proxy conversation. Naming someone as your healthcare proxy on a piece of paper is only half the job. The other half is the actual conversation, the one where you tell that person, clearly and specifically, what matters to you if a serious decision needs to be made and you can't speak for yourself. Do you want aggressive intervention in every circumstance, or are there situations where you'd prioritize comfort over extending life at all costs? Most people have never said this out loud to anyone, let alone written it down in a way their proxy could reference under pressure in a hospital hallway with a doctor waiting for an answer. This matters enormously for solo agers specifically, because in a married couple, even without a formal document, a spouse is often assumed by hospital staff to have some authority and some insight into what their partner would want. Solo, without a designated and informed proxy, that insight simply doesn't exist for anyone in the room, which means decisions can default to whatever the attending physician or, in some cases, a court determines, rather than what you actually would have wanted. So the action here isn't just filling out a form. It's having the actual conversation, ideally more than once, and updating it as your health and circumstances change over time. Let's also talk about something practical and often overlooked. A file, whether physical or digital, that consolidates everything a designated contact would need in an emergency. This includes your healthcare proxy document, a list of current medications and dosages, your primary physicians and their contact information, your insurance information, a copy of your advance directive, and instructions for where to find your will and other legal documents. Keep this somewhere your designated contact can actually access quickly, not buried in a drawer only you know about, and not exclusively on a password-protected phone they can't unlock if you're unconscious. Some solo agers keep a physical folder at home, clearly labeled, and give a copy of the key contact information to their designated proxy directly. Others use a secure digital service designed specifically for this purpose. The specific method matters less than the fact that it exists, is current, and is genuinely accessible to the person who would need it in a crisis. Let's return to the financial bridge for a moment, because there's a detail specific to solo agers worth naming clearly. In a couple, if one spouse needs to stop working earlier than planned due to health, the other spouse's income or benefits can sometimes absorb the gap temporarily. Solo, there's no automatic absorption. This means your emergency fund, the cushion of easily accessible savings meant to cover months of expenses if income stops suddenly, deserves to be larger and more conservatively estimated than generic retirement guidance typically suggests, precisely because there's no second income to lean on if something unexpected happens. A reasonable starting point for many solo agers is closer to 12 months of essential expenses in readily accessible savings, rather than the 3 to 6 months often recommended for working households with dual incomes. This isn't about fear. It's about building a cushion sized correctly for your actual situation, rather than borrowing a number designed for a different kind of household. Here's an important point of reassurance, because this topic can feel isolating if it's presented the wrong way. Being a solo ager doesn't mean facing retirement without support. It means being intentional about where that support comes from, since it won't arrive automatically through a spouse's role the way it might for a married couple. Friends, siblings, chosen family, and professional care coordinators can all fill these roles effectively, often just as well as a spouse would, but only if the roles are assigned deliberately instead of left undefined. Here's the recap. Most retirement planning assumes a spouse is present to fill certain roles: financial bridging, emergency contact, informal pair giving, automatic legal protections. If you're a solo ager, none of these roles disappear. They simply need to be filled deliberately by people you choose and processes you set up in advance, rather than left to chance or to whoever happens to be in the room during a crisis. The 5 pieces to build are your care team, your financial bridge calculation, your housing plan, your updated and accessible legal documents, and your long-term care funding. None of these require a spouse. All of them require intention, and ideally, they're built well before a crisis forces the decision to be made under pressure. If you're solo and you've never sat down and mapped these 5 pieces specifically for your own life, this is worth doing now while you have full capacity and no urgency pushing the decision. Start with the healthcare proxy and the emergency contact conversation, because that's the pace most people skip, and it's often the one that matters most in the moment it's actually needed. There's a related piece to this that deserves its own deeper conversation, specifically for those who became solo later in life through the loss of a spouse, rather than through divorce or simply never marrying. Filing alone can seem simple right up until a specific role changes everything about what you're entitled to, one most widows and widowers only discover after it's already too late to plan around it. We're covering exactly what that rule is and what changes the day you file alone next.